Hello everyone, my name is Andrew Jefferson. I am a second year undergraduate student at East Carolina University and I'm studying exercise physiology. With my time at East Carolina, I will learn how the body moves, functions, many other things in relations to bones, muscles, tendons, and so many more other things. I am currently researching Perthes disease, also known as leg-calf Perthes disease. So let's talk about it. What is Perthes? Perthes disease is a hip disorder where the blood flow of the femur, which is this whole leg, this whole bone right here, also known as the thigh. So for simpler terms, we'll call it the thigh bone instead of the femur. And with the femur, there's the head of the femur, which is about, if my hip's right here, which is about right here, and it kind of looks like a club. So if this was the thigh bone right here, this whole shape would be called the head of the femur. And so with Perthes disease, there isn't enough blood flow to the head of the femur, which over time can deform the shape of it. And typically it would be in the shape of a ball, just like a fist. And with the femur or the thigh bone, it fits into a socket of the hip. So to think about it in a simpler kind of way without, looking at a book or anything, is if you take your hand like a C and your other hand like a fist. So the C would be the socket of the hip, which is just about, here's the hip line, and just a little bit lower than that would be where the socket of the hip is. And then here, this arm would be the thigh bone, and this ball would be the head of the thigh bone or head of the femur. And so then it just fits like such into each other. And this is called a ball and socket joint. And so, like I was saying before, the C would be the hip socket. This would be the head of the femur or the thigh bone. And so then they fit. And if you put in relations to where this would be your leg, like say this would be my leg, like standing up, like how I am right now. And so then here would be the hip socket, and then here would be the ball of the femur or the thigh bone. And so we can move this way, such as kicking your leg out, or this way, which is bringing it back, this way, bringing it out, back in, and then it can also, kind of rotate about. So I'm just demonstrating my leg rotating. But with Perthes disease, this perfect ball, the head of the femur or the thigh bone, it starts to flatten out a little bit. So you just take your hand, come closer and show you. So here would be a typical thigh bone or the head of the femur. And if it starts to flatten out a little bit, the fist doesn't become as circular like a ball, and you make a C, you can see there's a little bit of a gap. I hope you can see that, a little bit of a gap between the socket and the head of the femur or thigh bone. So with this, it makes it a little bit harder to move about because there's no longer a perfect fit. So that's what Perthes is all about. It's how the head of the femur just doesn't fit quite right into the socket of the hip. So let's talk about what the symptoms of Perthes may be. With Perthes disease, you'll see somebody with a lot of pain in the hip area, and with Perthes, it can happen to just one head of the femur or thigh bone, or the other, or both, which is very uncommon, but it can happen. And so with a lot of pain, there comes muscle tightness, a loss of range of motion. And range of motion is simply how much you can move a certain body part. And so for our case, since we're talking about the hip, it's about how far you can move the hip. So if I say I had a range of motion about to right here, and somebody else had one only to about right here, this person would have a smaller range of motion compared to me, which could go a lot further out. And so that's what range of motion is. And so the hip has 6 different ranges of motion. There's one called hip flexion, which is just bringing the leg out forwards. I'll show from a side angle, hip out. There's hip extension, which is going from here back to neutral. And then there's hyperextension, which is bringing it behind the body. There's abduction or abduction, which is bringing the leg out. There's adduction or adduction, which is bringing it back to neutral. And so then there's also internal rotation, which is just, if you're talking in relation to your right foot, bringing your right foot across your body, which is internal rotation. And then external rotation is just bringing it out. And also with Perthes, the affected leg may grow shorter than the other one, which would result in an unimbalance between the two legs, with one being shorter, which would be the diseased leg, and one which would be the natural leg, which is the unaffected hip. And so let's talk about some different treatment styles for Perthes. So one thing that doctors can recommend, which nobody that likes any physical activity would want to hear, is that you want to limit physical activity, such as any impact sports like football, soccer, running, jumping on a trampoline, gymnastics, any of those kind of sports. But I talked to my physical therapist that I see. She recommended swimming for a good physical activity to do if you have Perthes disease, because you're in water, there's less weight, such as gravity pulling you down, and so that makes swimming a really good activity to do for the hip, and it also strengthens the muscles, because you're kicking in the water, working that leg, which is really good. So you're not completely out of any activity or any sports, but very limited. So another way to help Perthes is surgery, which would be the very last resort that you would want to happen. And with that, simply a doctor can go in while you're asleep, so you don't have to worry about anything. He'll fix the head of the femur and then put some screws in to help hold it in place, which in turn may have to put you in a wedge-shaped foam kind of block between your legs. There's one article that I was reading about a young boy named Drew, and Drew, he had the surgery, and so he had to sleep with and constantly have a foam wedge between his legs in the shape of a V, like such, just spreading the legs out a little bit. And that just helps the socket and the new head of the femur in place. And when it's abducted, which is just to the side of the neutral body position, and it just keeps the head in a good place to heal. Another thing that can be done is physical therapy is a way to help rehabilitate, which just means to bring anyone back to their normal way of life. It helps, physical therapy helps with any pain or strengthening or increasing mobility, which is just how you move about, and especially with Perthes, it can affect your gait, which is just the way you walk. It's just a fancy word, for how you walk. And then with Perthes, if somebody has a limp, that they're kind of dragging or swinging their leg over, which would be their gait. Physical therapy can just help, bring the swing away and just back to a normal kind of walking pace, if we're talking about walking. And now I'm going to demonstrate some exercises or stretching that you yourself can do. And as you can see, possibly, my bed's right here. I'm just in my room, and I just want to show you that you can do these anywhere. If you're at home, outside. That's just the great thing about exercising and stretching for you, is that really you can do it anywhere. And I'm going to show you a few exercises that you can do without needing any equipment, and I'll tell you what they're all about. And so now what I'm going to do is demonstrate and show you guys how certain stretches and exercises can really benefit you if you have Perthes. And so we're going to start off with first a glute bridge, and this one's fairly simple. So you'll start with 2 feet down, flat on the ground, lay back, and then you'll lift your hips up, and we're going to hold this for 5 seconds. And you should do 5 of these for 5 seconds each time. But for demonstration purposes, I'm just going to show you it once. So feet flat, down on your back, hands flat on the floor, and just lift your hips and hold. So 1, 2, 3, 4, 5. And then slowly come back down. This is really good because it works your glutes or your butt muscles, and you really want to get those glutes working when you squeeze your butt at the top. And so next, what we're going to do is a seated leg raise. And so this one also fairly simple. You're down on your butt like this. You're gonna have one knee bent and the other leg straight. And we're just gonna lift the other leg, the straight flat leg, up about like 6 inches, around just this height, whatever you can feel a good stretch at. And we're gonna hold that for 5 seconds also, and slowly come back down. So up, 1, 2, 3, 4, 5. And then slowly bring it back down. This one's good because it works your thigh, which is this whole muscle right here, and then also the outsides and insides of that same leg. And so whenever we're doing an alternating exercise or stretch like this one, you want to make sure you do the other side as well. So same thing, now the other leg bent up, this one straight, about 6 or so inches off the ground, and hold. 1, 2, 3, 4, and 5. And we're going to slowly bring it back down. So the next thing we're going to do is a pretty fun name. It's called a Superman. So here we're going to lay flat on the ground, stomach to the ground, and we're going to lift the arms and the legs at the same time. And same as the other ones, we're going to hold for 5 seconds. So on the ground, we're raising both legs and arms at the same time, and hold for 5 seconds, just like you're flying like Superman. So 1, 2, 3, 4, 5. And this one's also good because it still works the whole lower back, your butt, and the back of your legs, hamstrings. So then the next one we're going to do, it's going to be called a bird dog. And so for this one, we're going to be on our hands and knees, just like a dog. And we're going to lift one arm straight up and the opposite arm. So for me right now, if I'm lifting my right arm up, I'm going to be lifting this back left leg. And you want to hold it straight back and try to make it in line with your whole body. And you're going to do that and hold for 5 seconds. 1, 2, 3, 4, 5. And same with the straight leg raise, we're going to do the other side. So now I'm going to lift the left arm up and kick the right leg back and hold. 1, 2, 3, 4, 5. And this one is good because it, just like the Superman, it works your lower back, your butt, and the back of your legs. So now what we're going to do, which is really important because with many people with Perthes, they have a hard time abducting the leg. If you remember from earlier, abduction is just bringing the leg out. And so for this one, we're just going to lay on our side, have one leg on top of the other, and just lift one leg straight up. Same thing as the sitting straight leg, but now we're just on our side. So, and we're going to hold for 5 seconds. 1, 2, 3, 4, 5. And then slowly bring it back down. Just like the other, we're going to switch sides and make sure to get both sides strong and we don't leave one out. We're going to do the other side. So now I'm bringing my right leg up and hold it. 1, 2, 3, 4, 5. And slowly bring it back down. Just to remind you, that one works that outside of the legs, the hip flexors, and that motion is abduction. So now, this one has a pretty funny name. It's called a clamshell. Same thing as we just did, laying on our side, but now the knees are going to be bent together like this, and you're just going to open your leg up. So we're going to do this 5 times. So 1, 2, 3, and try to do these slow. 4, 5. So that's just going to work the outside, the abductor, the hip abductor right there. So now what we're going to do is a butterfly. And so we're going to bring our legs together like this, almost like crisscross applesauce. And for this one, what I like to do is I like to not push down with my hands, but push down with my elbows. And so I'll have my hands on my feet like this, and just push down with my elbows, kind of like where your calves will be. So this one, we're just going to hold it for, this one can be like 7 to 10 seconds. I'm going to do 10, and you just want to push down until you feel a nice stretch. And even if that's up here or a lot lower, whatever works well for you. So for this one, to help push down, you might want to just bend over a little bit and then use those elbows and push the legs down. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If you feel like you're getting a good stretch originally, you can push down a little bit more, but not too much to where it hurts, but just to where you know you're getting a good stretch. So this next one we're going to do, which is really important, is the windshield wipers. And for this one, this is really good for the internal and external rotation. So we're going to have our knees bent up like this, hands back however you like, the feet about shoulder width apart, and we're just going to let them fall to the side like this. And so for this one, as you can see, you don't have to have both legs on the ground, just until you feel a good stretch all throughout right here. And so for this one, we're going to do 10. So that one would be 1. Now other side, same thing. 2, don't need to go all the way down unless you can. And then back up. 3, 4, 5. You want to try and hold it for like 2 to 3 seconds when you go down to get a really nice stretch in. 6, 7, 8, 9, and 10. That one's really good for the internal and external rotation. So now we're going to do a a knee hug. So for this one, we're just gonna lay flat on our back and we're gonna pull our knee to our chest. Not hard, just until you feel a stretch. So we're gonna lay down flat on our back, bring the knee up. I like to kind of interlock my fingers and get around my kneecap, which would just be right here, like just below the kneecap. And then just pull it in. You should feel a nice stretch. We're gonna hold this one for about 5 to 7 seconds. So I'll hold this one for 7. 1, 2, 3, 4, 5, 6, 7. And then we're gonna alternate sides. And just like the butterfly, if you feel like you got a good stretch in the beginning, but can go a little further, try to pull a little bit further, but not until it hurts, just until you feel another good stretch. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And this one, you'll feel a strip kind of on the side of your hip. It'll just be a nice feeling. And so, last thing I have for you guys is it's kind of an exercise that you'd need to do with 2 people. Just get like a parent, a sibling, or a friend to help you out with this one. And it's kind of fun because it engages a ball in, kind of doing stuff together or multitasking. So you're gonna want to get something like a pillow, like a couch pillow. A firm couch pillow would probably be best, but I'm just gonna use 2 pillows from my bed. So we're gonna have one knee down. So for this one, I'll have my right knee down, and then my left leg up, like this. So you're just gonna have somebody toss you a ball. It could be a football, a tennis ball, a lacrosse ball, but nothing too big like a basketball. You don't want to like hurt yourself while doing this, but something simple. So what they'll do is they'll toss it to you, but not directly at your chest all the time, but they're gonna make you want to like work for it to the side. And this is really good for the hip extensors and the core, just your hip ball in general, really. And this one I saw my physical therapist that I shadowed do this with one of her patients that had Perthes, and he was smiling through it, having a good time, and because it's just a fun activity, because it makes you work for a ball over here, and while this you're moving about, getting different stretches, different directions throughout this whole hip, this side, and catch here, sometimes you might have to move your leg over to catch yourself, but the goal is to maintain the same position and just moving your upper body. And then you can switch to the other side, same thing, one knee down, one leg up, and then just catching a ball from either side. So that's all I have for you guys today. I hope you enjoyed, and hope you have a nice rest of your day or night or whenever you're watching this. Thank you, and goodbye.